Hi, Dr. Corey Maas here and Looking Your Best. I wanted to get to a couple of our more recent questions that have come in, and more importantly, I want to talk specifically about the new products that are coming on board because there's a lot of confusion. There are 3 now neuromodulators, or quote-unquote toxins. We don't particularly like to use the term toxin because all medicines in the wrong dose are toxins. But the neuromodulators, in my mind, include all of the botulinum toxin A. They're all serotype A's that we use in aesthetic medicine and plastic surgery. Botox cosmetic is the most commonly known one. Many of you have heard me talk about Dysport, and in fact at our website at maasclinic.com and on my blog, drmaas.com, I've placed some information about some studies that we've done comparing the two of those, and I encourage you to visit those sites if you want to learn more. As a result of that, a lot of people are asking, well, can we use more than one product and take advantage of some of the subtle differences between the products? Botox may behave a little differently than Dysport. What we showed in a split face trial where we did Botox on one side and Dysport on the other in the crow's feet region was that there was a slightly better smoothing effect with Dysport. In fact, 1 point or 20% on a 5-point scale when you were measuring this thin, very small muscle that's located around the eye. Say it's small, in square area it's large, but it's a very fine muscle, and it did a better job of doing smoothing. So I think a lot of people are thinking, well, it does a better job of smoothing here, and Botox works more locally. Can we do Botox in the glabella or Xeomin in the glabella and Dysport in other areas? And there have been some strategies and surgeons talking about mixing these products, in fact, in targeted ways, doing Botox or Xeomin or Botox and Dysport on the same patient. There haven't been any controlled trials looking at mixing the products. There's no theoretical disadvantage physiologically, other than the proteins are slightly different, and like a lot of vaccines that are proteins, there would be a slightly higher theoretical chance that people could develop blocking antibodies. What does blocking antibodies mean? Blocking antibodies means that your body is recognizing these proteins as being foreign invaders, a lot like they would a virus, and thus create an antibody that would attach to the protein and ultimately destroy it. What we know from the cosmetic surgery literature over the now 15 or more years that we've been using Botox, that the incidence of these blocking antibodies, we call it tachyphylaxis, there's another fancy term for it, where they aren't as active, is that it's quite rare. It's quite rare in cosmetic surgery because we don't use very big doses and they're very limited in their frequency. In the neurology literature, where they'll be using 300, 400, 500 units of Botox in one setting for large muscle spasticity, there is a measurable incidence of this tachyphylaxis or partial responders or antibody formation, blocking antibody formation. So that's the long answer. The short answer to a question about mixing and matching Xeomin, Botox, and Dysport in the same patient is I'm not doing it as a part of our practice. The theoretical disadvantage, of course, is this issue of blocking antibodies or tachyphylaxis. For most patients, we'll let them choose. There are very good features of each of them. As I've mentioned in some of my previous videos, I don't think that the MERS people have the dosing quite down correctly, and I think I've got a good idea of right dosing ranges, so we certainly offer it. And as we move forward, I think we'll see Xeomin become a much more important player, just like we've seen Dysport rise in its importance relative to the 800-pound gorilla in the room, which still is Botox cosmetic. So if you have any other questions or thoughts on the treatment with these injectables, I've written lots of papers on them. I encourage you to visit our website at drmaas.com where those are referenced. You can see those papers. Certainly you're welcome to send in a video to my drmaas.com blog and or photographs. I'm happy to answer, or just questions. And as always, I'm happy to respond. This is Dr. Corey Maas on Looking Your Best.